Hey guys, it's Dr. Babes, and welcome to another episode of The Good Doctor. For today's episode, let's enter the world of fungi. When people think of fungi, people may think of something gross. Many think of areas that are dark with moisture, which is, well, sure, you can find it there. But you can actually find it in all kinds of places. In soil, in your house, in aquatic environments, or on you. Yes, all of us have fungus growing on us, just like all of us have bacteria and viruses that are on or in us right now. Usually, our immune system is able to keep them at bay, so we don't even notice that we have something going on. Fungal infections, are also called mycoses, are diseases caused by fungi that affect both animals and humans. Humans are usually resistant to fungal infection. They do not lead to serious illnesses, but should not be underestimated to avoid further complications. Fungal infections range from superficial to overwhelming systemic infections that can be fatal in a person with a weak immune system, or what we call the immunocompromised. There are 5 major classifications of fungal diseases. Please keep in mind that when I say mycosis, we are referring to the term fungal infection. First, we have the superficial mycosis. This involves the hair and epidermis, or the top layer of your skin. These could appear as light patches if you have brown or dark skin, or as dark patches for someone with fair skin. The patches are dry, flaky, or scaly, and can be flat or slightly raised. They may be a little itchy, but often aren't felt at all. For the hair, you may notice a white or black nodules or lump, usually along the hair shaft near the scalp. Next is cutaneous mycosis. Cutaneous mycosis is the most common type of fungal infection in the world. These includes athlete's foot, chalk itch, and ringworm, which is not caused by worms, by the way. This is actually caused by a fungi called dermatophytes. You see, the hair, skin, and nails are all made up of protein, and main component is called keratin. Then here comes the dermatophytes, which actually releases an enzyme called keratinase, which digests keratin, leading to hair loss, shedding of skin, and brittle nails. These types of infections are usually found in warm, humid areas of the body, presenting as itchy, red, circular rash. Our third classification is the subcutaneous mycosis. When we say subcutaneous, this is the layer under the skin. Fungus that usually cause these infections usually reside in soil or vegetation and enter the skin following a trauma or injury. This occurs most often in gardeners who get pricked by thorns. So if you love gardening, it is best to use protective gloves. Next up is the systemic mycosis. This type of infection can be acquired through inhalation, and such cases are usually endemic or more common in only specific places. A healthy individual would usually present with no symptoms, but if you have a weak immune system, this could cause pneumonia, which could potentially be fatal. Lastly, we have the opportunistic mycosis. From the word opportunity, these fungi cause infection when they have a chance. They usually affect those who are weak or compromised immune systems, brought about by medical conditions or immunosuppressive treatments like steroids. These could also include someone who has been hospitalized or exposed to extensive antibiotic therapy. These could also include those with chronic diseases or seriously ill like cancer or HIV. But in a healthy individual, they cause no harm. An example is Candida. The Candida species, like bacteria, are actually part of our body's normal microbes. However, if something changes the balance, like when good bacteria is killed by antibiotics, or your immune system decides to pack up and go on a holiday, it becomes a serious problem. It can overgrow, ride your bloodstream, and go to different organs. This could present as a wide range of symptoms, from an oral thrush to skin infection or even vaginal infection in women. Now, all fungal diseases are not contagious except for cutaneous mycosis. So it's really important to observe proper hygiene and to consult your doctor if you have a suspicion that you might have a fungal infection. You can also consult us using the link provided in the description box, all for free. This is to make sure that you have the right diagnosis before anything is treated. Check out our previous video if you want to learn more on how to prevent these kinds of infections. Now, fungi are not actually good or evil. While it is true that fungi can sometimes be a little problematic, but fungi also do a lot of good, especially in our ecosystem. Many fungi are involved in some of the food we eat, like producing some type of cheese or helping the bread rise by using yeast, which is, yes, yeast is fungus. Even the mushrooms on your favorite pizza themselves are a fungus. Many antibiotics are derived from fungus as well. In fact, the first antibiotic, penicillin, was accidentally discovered from a mold, which is, yes, a fungus. In the world of fungi, there's so much more to discover, and there's much room for learning. Let us know what you think. Put it in the comments below and click the subscribe button and hit that bell button for more healthcare tips and medical advice. That's it for today's video, and stay curious, stay informed, and we'll see you next time. This has been your good doctor.